The warning we got from Governor Charlie Baker today was pretty clear. While you might be tempted to let loose a little for the holiday weekend, now is not the time to let your guard down.
And we have a big weekend coming up. It's 4th of July. I really hope people continue to take this seriously. I think our biggest concern here in Massachusetts is that we take a victory lap. There are no victory laps from COVID, okay? I've said this many times. I've been a broken record on it. It's not going to take the summer off.
Of course, one guy who has been taking a victory lap and won't be staying home for the holiday is Donald Trump. He's planning to attend a celebration in Mount Rushmore on Friday, with around 7,500 other people expected to attend. Very limited coronavirus protocols, as South Dakota's governor told Fox News earlier this week.
We've told people to focus on personal responsibility. Every one of them has the opportunity to make a decision that they're comfortable with. We told those folks that have concerns that they can stay home. But those who want to come and join us, we'll be giving out free face masks if they choose to wear one, but we won't be social distancing.
Sounds like a death wish to me, especially with the new study out today in JAMA Internal Medicine indicating COVID-related deaths could be as much as 28% higher than the official tally. At this point, even some of Trump's longtime apologists are getting critical, begging him to set a better example.
Occasionally, the president might want to wear a mask just to signal to people that he thinks it's important.
MAGA should now stand for masks are great again.
If only. And speaking of MAGA, just over a week after Trump held a largely mask-free campaign event in Phoenix, Mike Pence headed back to the region today as a show of support in the state's efforts to fight the spread of the coronavirus. As of today, though, Arizona is reporting a new daily record of more than 4,800 cases confirmed, and close to 1 out of 3 people who were tested yesterday tested positive. For comparison, fewer than 1 in 50 people are testing positive in Massachusetts right now. But as Charlie Baker said, we're far from out of the woods just yet, but July 4th is upon us. I'm joined by Dr. Camara Phyllis Jones. She's former president of the American Public Health Association, now a fellow at the Radcliffe Institute for Advanced Study and senior fellow and professor at Morehouse School of Medicine. Dr. Jones, good to meet you. We're also joined by Dr. Bhadelia, an associate professor at BU School of Medicine and a physician at Boston Medical Center. Good to meet you too, doctor. Thank you both for being here. Can we start locally, Dr. Bhadelia, with you, if I may? Governor Baker seems to be saying what he says every day, relentlessly, which I think is good. Be careful, play by the rules. New York Times lead online story today, their headline was tougher. Stay home on July 4th. Health officials urge as caseload hits record. Who's right, or does it simply depend on what part of the country you're in?
Well, Jim, I think there is a inherent sort of built-in element of this, of what the prevalence is in your community, given the fact that the prevalence is lower in Massachusetts. And again, clearly we're not going to be resting on our laurels because majority of the serology tests, the antibody tests that talk about how many of us have actually gotten it and may be immune, are showing that majority of us are still vulnerable. But I think what Governor Baker has done and what we've seen Boston do really well is chart out this new normal for people. What happens once we come out of this lockdown that is sustainable, which is recognizing that there is a big difference in risk between activities that are outdoors versus activities that are indoors. Smaller groups, outdoor settings, use of masks seem to be driving much fewer number of cases, which means that we can still do those things and be active this weekend and protect ourselves.
Dr. Jones, I assume you agree with that, yes?
I agree. I would add social distancing even when we are in our small groups. So that's, hey, how are you? Throw the ball or something, but maybe don't throw the ball because I don't know if you have COVID on your hands. So I think that we have to just really understand that this virus has one job, which is to reproduce itself.
By the way, throw the ball, just don't catch the ball, I believe is what the instruction should be. But, isn't there a cautionary tale coming out of California? I know we're doing most things right here in Massachusetts and throughout New England. California was the first state to lock down. California was very aggressive in their antivirus work, and there's an explosion yet again. So is there a moral, Dr. Jones, of the California story for us in New England? Is there a warning to us somewhere in all that?
Well, there's a warning, and there's also an example, because San Francisco is not as affected in terms of the rebounding numbers of infections as other parts of California, and I think they've still
what's that mean?
more. So that they are more still sheltering in place, honestly.
I see. You know, the other thing, one last thing about Massachusetts, if I can, Dr. Bhadelia, you retweeted a fellow doctor's tweet yesterday about a milestone in Massachusetts, 0 deaths in yesterday's report. But sometimes good news is bad news. Do you worry that it helps create a false sense of security? Summer's here, hot weather's yet around the corner, and 0 deaths seems to be sending a message despite the words of the governor and people like you two, no?
Well, I think that we cannot just have bad news every single day. We have to take our wins, particularly when we made the sacrifices that we made over the last few months in lockdowns. I think that we've seen that the people of Massachusetts, were responsible during that lockdown, which is why we brought this down. And as I mentioned, I think that good news needs to be, as you clearly said, cannot let us let our guard down, and needs to be, gauged with the caution that look at other places where we've opened up. The other day I was driving by Fenway. Outdoor dining basically was people crammed together in these restaurants, and that can't happen. If I could say a word of caution, I would say, even as we do outdoor dining and other things that might appear safer, we still have to maintain, as Dr. Jones said, that physical distancing. And so I echo your concern. I think that today's deaths, unfortunately, are not 0. So, that goes to tell you that every day is going to be a continued battle.
Let's step back and spend more time on the national picture. Dr. Jones, California is not alone. Obviously, we know about Arizona, we know about Florida, we know about Texas in particular, and those are the kind of places Dr. Bhadelia is referencing, I think, where we saw the videos, the horrifying videos of people shoulder to shoulder at the bars. Dr. Fauci, before the Senate yesterday, had a very scary tale. Is that an accurate one? How bad are things across this country?
Things are bad because the picture that we have of the infection is a 1, 2, or 3 week old picture, because we're not doing the kind of surveillance where we know right now what the infection rates are. So if we're just looking at symptomatic people, that's a 1 2 week old picture. Hospitalizations are 2 to 3 weeks old. Deaths are 3 to 4 weeks old. And when you have an infection that's spreading exponentially, you can be way off. I just wanted to say too, may I just about letting our guard down. It's almost as if, we're in this huge storm with our umbrella. We're walking out. We say, oh, I'm dry. And so we say, oh, it's time to let the umbrella down. The storm has not ceased. We must keep up the things that we know to do right, which are our public health strategies.
Doctor, I think I was going to say everybody agrees with that, but of course everybody doesn't agree with it, or you wouldn't have to say it. Dr. Bhadelia, I know you've spent part of your career working with Partners in Health. Partners in Health obviously is leading the contact tracing effort in the state, and they've elevated it to an art form around the world. But if you have 45,000 cases a day, nationally, how do you possibly contact trace? It's impossible, isn't it? The numbers simply don't work.
Well, I think that, even countries that have had much bigger challenges than us, yes, we are a bigger country, and I think it requires national investment in this because it is a tried and proven strategy. Even countries like DRC, the Democratic Republic of Congo, today you had Director General Tedros of WHO talk about the efforts that went into stopping that outbreak with contact tracing, with case finding. If you have a country that has, the severe issues of distance, of logistics, of armed conflict, able to do that, for us, it's a failure of imagination that we can't do it. What needs to happen, unfortunately, is that we need to bring the cases down. Here's how it's possible. We make those investments to make that contact tracing capacity larger, but then we need to bring those cases down. And maybe that means that in areas where we're seeing large number of cases, they will have to do lockdowns again. Nobody wants to do that. Doesn't seem to be culturally or politically or economically acceptable. But that would be the path to the point where we get to the number of cases where then we can open up without contract tracing, which, by the way, was the original plan.
The other strategy, of course, doctor, is we can just pretend they don't exist, which obviously is a strategy coming out of at least one powerful residence. Can we step back for a minute and spend the last couple of minutes on something I'm borderline obsessed with? Dr. Fauci, a week or so ago, talked about part of the problem being this anti-science bent in this country, and whether it's COVID-19, whether it's climate change, the anti-vaxxer thing. Dr. Jones, let's hear from a guy who personifies the anti-science bent. This is I was going to say this dope, and I apologize for what I was about to say. I shouldn't have said it. This is Lieutenant Governor of Texas, Patrick. Just listen to him.
Fauci said today that he's concerned about states like Texas that skipped over certain things. He doesn't know what he's talking about. We haven't skipped over anything. The only thing I'm skipping over is listening to him. And he has been wrong every time on every issue. I don't need his advice anymore.
By the way, Austin, Texas has the highest positive test rate in the United States of America, but they surely don't need Fauci's advice. How do you break this anti-science hold that so many people have on this country, Dr. Jones?
Oh, that's a very good question. I would say that we have to just look at other countries and look at what's worked. I mean, we don't even have to call it science. We just need to get out of our American exceptionalism and see that in China, that in Singapore, South Korea, and many other countries, now in Italy and Spain and all these other countries, they have done things that have worked. So if we don't want to call it science, let's just call it doing what works.
How about it, Dr. Bhadelia? Do you have a cure?
No, if you look at the experiences that we've had, every outbreak that I've been part of, so as part of the West Africa outbreak, as you said, with Partners in Health and WHO, I've been part of the DRC outbreak on the Uganda side for the last couple of years. What you discover is that there are sometimes pockets of resistance to public health measures. And I think that when it comes to us, we tend to think, well, that doesn't happen in this country, but it's the same thing. You have a portion of the population that's sort of not listening to the public health measures and is not sort of taking the advice to heart. And here's what's worked in those other situations. Polio, same story. Polio eradication, we've been able to have been trying to get the cases down. What's worked is we have the national strategy, we have the state strategies and the technical stuff, but you have to go closer to community and talk to the people and get on the stakeholders, community stakeholders, that people that are not listening to the national picture will listen to, local radio, religious leaders. If we get those people on board and distribute this important message through those venues, I think people are more likely to potentially listen.
Dr. Jones, I only have half a minute left.
Just one more thing.
Yeah.
And the president needs to wear a mask, because huge number of people still listen to what the president does.
Dr. Jones, I want to finish with you just 30 seconds. You've spent, I said before, sometimes good news is bad news. Let me reverse it and say sometimes bad news might be good news, and I want to get your quick thoughts. You've spent much of your career talking about the disparate impacts around public health for people of color based on racism, not race. Is it possible that the perverse benefit of this coronavirus nightmare is that more people are finally going to pay attention to that critical message?
Well, that's wishful thinking. I would say that right now what we're seeing is that when the message comes out that communities of color are disproportionately impacted, what the president said was, oh, okay, well, let's reopen, liberate Michigan, liberate Virginia. So I think that what we're seeing instead is a continued devaluation of the lives of Black, Indigenous, and people of color. So
I hope it ends. Dr. Jones, Dr. Bhadelia, I really appreciate your time. Thank you so much for being with me.
Thank you.
Thank you.